I'm going to pass it on to Essie and Leslie to introduce themselves and talk about the content they will be sharing with us today.
Thank you, Mangshi. Hello, everybody. Hello, hello. Happy Thursday. Really happy to see folks. Thanks for coming. My name's Sarah Elise. I go by Essie. My pronouns are she, hers. I'm a CHW and the CHW Sustainability Lead with Envision, and I'm coming at you from Papillion, Nebraska. Leslie?
Thanks, Essie. Hey, everyone. Happy Thursday. I'm Leslie Wolf. I use she, her as my pronouns. I am based in Madison, Wisconsin. I am Envision's Director of Programs, and also I bring a lens to this work of community organizing. So I'm a community organizer by trade, and so that is also the where my heart lives when we talk about sustainability. And so we are going to dig into it together. Back to you, Essie.
All right, let's go over some objectives. What are we going to talk about? What are we going to learn today? So by the end of this session, y'all are going to be able to define CHW financial sustainability. You'll be able to describe the 4 major pathways for achieving financial sustainability for CHWs. You'll be able to recognize how CHW leadership, allyship, and how relationship building really serve as the foundation for advancing CHW financial sustainability. And we'll build on insights from the previous webinar on growing CHW power, the one from last week, and we'll explore some additional tools that support really the planning and implementation of a CHW sustainability plan. Okay, y'all, I just said financial sustainability like 500,000 times. So what is it? Let's define it together and be on the same page. Last time we talked generally about what is CHW sustainability in general. This week, we're really talking more specifically about financial. So this is about securing resources, including financial infrastructure for additional or continuous revenue that are generated to support the continuous CHW programs, workforce development, and employment. Pretty simple. Not really. So let's talk about the different financial sustainability pathways. On the next slide, please. So y'all, we know that the CHW workforce, we're scrappy, but what we really need is sustainable funding for this impactful work. We're going to briefly describe the 4 major pathways. Recognize that we're saying major. There are other options, but these are the ones we're really going to focus on. So there's reimbursement through Medicare and Medicaid, internal financing for CHW integration, and blended and braided funding. Let's talk about Medicare first. So Medicare, what is it? It's a federal program that provides healthcare coverage for people who are 65 and older and for people with certain disabilities. Unlike Medicaid, Medicare is 100% federal. Now that's important because it means that the state government has virtually no role in deciding what happens in the implementation with Medicare. Now, last year, a new rule went into effect for Medicare to offer coverage for some CHW services, which is really exciting. Now, in order for CHW services to be eligible for reimbursement through Medicare, 2 requirements must be met. 1, a billing provider must determine that CHW services are necessary for their patient. And 2, the patient must be enrolled in Medicare Part B. Let's hear more about how Medicare can work to pay for CHW services. So there are Medicare billing codes that are eligible to be used for CHW reimbursement. Now, the CHI code, which stands for Community Health Integration, is really the one that most easily translates to CHW work. So that's the one we're going to focus on today. Now, CHI is a Medicare program aimed at improving care coordination by linking community health services with clinical care. It can include payments to connect patients to community resources like food banks, housing support, to enhance health outcomes. And it assists healthcare providers in coordinating care with local organizations. I'm sure this sounds really familiar to a lot of the work that CHWs on the call do. I'm going to give a quick little hypothetical story about what this could look like. So let's say there's a provider, a PCP, primary care physician, who's working with a client who has diabetes. And this person is enrolled under Medicare Part B. This person they don't have access to the food that they need. That would be a part of a healthy diet for them with diabetes. They are unhoused. And this really impacts the ability of the care provider to treat the patient. And so this provider could put in a referral for a CHW to come in and support those health-related social needs, HRSNs, as you can see on the slide, like connecting them to housing, the food bank, addressing those social, emotional needs of the patient and the family. And those are things that can be reimbursed. But again, the provider is the one who determined that CHW intervention was necessary in order to properly treat the patient. And that's one of the things with the Medicare. Let's talk about Medicaid next. Okay, with Medicaid. Medicaid is a federal program, but unlike Medicare, Medicaid is managed state by state. So Medicaid is a vital federal program that funds state health services for eligible individuals. And while federal policy mandates certain essential services, the states do have significant flexibility in how they administer Medicaid within their borders. So each state is required to develop a state plan that outlines how services are going to be delivered to their Medicaid population. And this plan acts as kind of like the blueprint for Medicaid services within the state. Now, when a state wants to make changes, such as adding new benefits or altering provider payment rates, they must first obtain approval from the Centers of Medicare and Medicaid Services, also known as CMS. So Medicaid can cover some services provided by CHWs. However, for this to happen, states need to secure a waiver or amend their state plan to include these services, allowing them to be reimbursed through Medicaid. I know this is complex. We're going to talk a little bit more about it in the next slide. Okay, digging into it a little more. Medicaid can cover some CHW services through two main pathways. First, there is the Section 1115 demonstration waiver, and this is the one that's most often used for CHW work. This option is temporary. It typically lasts between 3 to 5 years, but it can be renewed. Now, one key requirement for this waiver is that it must demonstrate something called budget neutrality. That means that the cost of the waiver cannot exceed what they would have been without it. Now, the second option is through state plan amendments, or SPAs, and that probably sounds familiar to a lot of you. Unlike the waiver, SPAs make permanent changes to the state plan. These are required when a state wants to add CHW services as a regular Medicaid benefit. Importantly, SPAs do not need to show budget neutrality. So they do not need to prove that the costs would not exceed what they would have been without it. Now, right now, currently 15 states have approved SPAs specifically for CHW services. And most of these SPAs authorize something called fee-for-service payments for various CHW roles, like health promotion, care coordination, and health education. Okay, so what are the limitations of Medicare and Medicaid? Some of you might already be thinking of some of the things that are coming up for you. Now, both Medicaid and Medicare are essential, but they are not sufficient on their own for supporting CHW services. Medicare does cover a lot more than Medicaid might, such as it covers the cost of travel to and from places or a client's home, and at a much better wage than Medicaid reimbursement. But still, neither one can cover all the things, all the different activities and roles that CHWs do, such as community advocacy and that really intentional relationship building. So again, while Medicaid only pays for specific healthcare services, CHWs focus on building relationships with the community, and that requires different time and effort, which is not reimbursable. Not only that, but both Medicaid and Medicare, it can only pay for services for folks that are insured by both Medicaid and Medicare, and this leaves out millions of uninsured or underinsured individuals from receiving CHW services. So that is another major limitation. And lastly, once again, a major limitation of Medicare reimbursement, but nothing that makes it impossible, is that CHW services must be determined necessary by a provider and fall under one of those specific payment codes, which can make implementation challenging. And it's also new, so we don't have a whole lot of infrastructure in place for using it, but not impossible. Okay, I'm going to pass it over to Leslie to talk about some of the other pathways.
Thank you, Essie. And I do see a question in the chat, and I just wanted to note two things before I continue on the pathways. One is that there was a question about where to find out about the 15 states, and we can definitely put a link in there to NASHB, which would be a good space to start. And it's possible that one of the folks on the team can pull that link together for y'all as we're talking through these other pathways. The other thing I wanted to note, because usually this comes up around this time, is the question of if the slides will be made available. And the answer is yes, these slides and recording will be available.
And one thing I also want to note, I apologize, we had some old information. There are 23 states right now that have the spas. And Sherry just posted that NASHB link so you all can see who are the folks that have it. And we'll talk more about that and maybe how you might want to reach out to them or see how they're doing it and how you might be able to do it in your own community. All right, Leslie, go ahead.
All right, cool. So I'm going to talk about systems change for CHW integration. And we're talking about CHW integration in a couple of ways. So we're talking about internal financing and the systemic changes needed for organizations to integrate CHWs. Because it's not just about intentionally budgeting to fund CHWs and their programs, but also having the foundations in place for equitable and sustainable CHW programs. So things like utilizing core competencies, appropriate supervision, training, et cetera. So organizations, what this is really about, though, is organizations using their own funds or profits to finance CHW positions. And that's done when CHW roles are included in the employer's operating budget. So some examples of employers, when we think about that, right, is like health departments using tax dollars such as levies, hospitals, especially nonprofit ones with community benefit requirements, and community organizations like libraries or YWCAs. And this approach is really popular when CHW work aligns with the organization's goals and shows a return on investment. Some limitations to consider, though, is that depending on the employer, this can result in the medicalization of CHW roles and or limiting the CHW role, based on the mission of the employer. So this is where it's really important to have that infrastructure in place where we think about, really emphasizing core competencies of CHWs and understanding the value of the CHW role. And that's where we'll see really successful CHW integration. Thank you. All right, so the next pathway that we're going to talk about is blended and braided funding. And when you're thinking about sustaining CHWs, it's likely CHW rolls through financial sustainability, right? It's likely that you're thinking at some point or using at some point blended and or braided funding, especially braided funding. And so braided funding really coordinates two or more funding streams, but maintains each of those fundings connection back to its original source. And therefore, like any constraints that's on those original funds also maintains. But you can see from the picture, right? It's actually it's literally braiding them together, bringing them together. So you see one braid, but each of those streams is what makes the braid. And so there's a number of examples of braided funding. Most commonly is the hub model that provides the administration and coordination of those different funding streams, allowing for that greater flexibility to provide a multitude of services for multiple populations. So we were hearing Essie talk before, right, about like when you're thinking Medicaid, it's really just people that are insured on Medicaid or Medicare, just Medicare. So this allows for multiple populations, including folks that are uninsured. And since braided funding requires negotiation with multiple payers, the administration of that can be really challenging, complex, and at times expensive. So that's sort of one of those downsides of it. Okay, so then on the left side, you see the example of blended funding. So blending funding really refers to pooling two or more funding sources into one funding stream. So we think of that blender image. And the idea is like a smoothie. All the distinct ingredients go in and come out as one delicious smoothie. So blended funding can be delicious, right? It's but it is actually, it's less common, and largely because it really requires trusting strong relationships and clear agreements with all parties involved. So one example of this is Roots for Change Cooperative, which is a really powerful example of blended funding at work. At the core, it's this multi-member cooperative made up of independent businesses owned by Latina and Indigenous doulas and community health workers. And each member is like enterprise, generates earned income. So each one has their own stream of earned income, offering services like doula care, health education, yoga, and consulting. And at the same time, the cooperative, because it's organized with a social mission, they can access grant funding and philanthropic support. So, for example, they received funding from Feeding America to run its Farms to Families program, which supports both local farms and food insecure families. So by combining that commercial revenue, public and private grants, and shared infrastructure, the cooperative creates a blended funding ecosystem, one that really supports both sustainability and impact, all with a single mission-driven organization model. Now, this is six CHWs that are doing this work together. So keeping that in mind, this works because of the trust they have with one another. And this is a really small scale example. It's challenging to find a large scale example of a fully blended funding model. Because you can imagine the kinds of relationships, the depth of relationship that needs to be in place for everyone to pool their various income resources into one organization under one cooperative. Okay. Advance the slide. All right, so we know we've discussed these four major pathways for CHW financing, but what is Envision's approach to financial sustainability, right? That's the title of what is bringing us all together here. So you'll recall from this image, if you were in the last webinar, or maybe in any one of our webinars recently, because we bring this one up a lot, that Envision's approach to growing CHW power is really through relationships and aligning interests to motivate change and drive collective action. And so we're using that same approach to advance sustainable financing across the four pathways. Advance the slide. Thank you. Oops, didn't show up yet. If we can advance the slide, please. Thank you. All right. So also, if you were in the last webinar or talked to us recently, you'll recall that relationships are a source of power, right? That's that source of power. So it's really engaging with that source of power to get closer to achieve our goals. Advance the slide, please. So we want to explore that concept, right? This concept of relationships when it comes to these four pathways. And when we think about what relationships you already have or need to develop across each pathway. So Medicare, for example, we talked about healthcare providers are essential, right? So we know we need to either have relationships or develop relationships with healthcare providers, with private insurers, aging agencies, would also be key. If we're thinking about Medicaid as a pathway, state Medicaid office, state health department, or health plans and managed care organizations, providers, elected officials. And we say elected officials here in particular because one of those spaces where we can impact things related to Medicaid, right, there is this connection, this relationship to elected officials because of how it comes down to the state level. CHW integration, we see elected officials being listed as that first one there, right? Again, because if you're thinking about health departments and tax levies, then that's an important relationship to foster. Also community-based organizations, the health departments themselves, healthcare systems, insurance plans. And then, as we mentioned before, like with blended and braided funding, you're likely to employ this approach in some way. So we could have listed everything under the sun, and we just listed a few of the key partnerships or relationships, like health plans, state government, community-based organizations, health systems, state agencies, such as Medicaid and housing. Okay, so there's a lot on this slide. Let's unpack this just a moment and just think about one of them. Let's think about Medicare. And we're saying you need to be in a relationship with healthcare providers in order for CHWs to get reimbursed. So that's CHWs want to be in a relationship with healthcare providers if they're looking at Medicare, because that's how CHWs will get reimbursed for those services. But why would a healthcare provider want to be in relationship with CHWs? So we want to ask you that question. Just take a moment, think about this. Why would a healthcare provider want to be in a relationship with CHWs? And if you can consider that and put, we'd love to welcome y'all to either put an answer in the chat or feel free to come off of mute. What do you think?
Hi, this is Monica.
Hey, Monica.
Hi. One, it increases, it closes the gap for patient outcomes. And also it is an increase to the ROI for that provider because they're seeing increased visits and follow-up for that patient. So that comes down to the billing and accessibility of payments and access to reimbursement.
Yes, thank you, Monica, for coming off of mute. Appreciate your voice. And we see some additional comments similar to that in the chat here, right? CHWs improve health outcomes, exactly. And it's a great way to increase coordination of care. Absolutely. Right, so we know this, like Monica said, it closes the gap, it increases the return on investment. And you know, what's true is healthcare providers do care about the outcomes for their patients, much the same way that, you know, anyone in the field, right? They care about the outcomes and all these other reasons. And I'm sure there's more swimming around in our heads too. I want to advance that slide, please. So to foster a connection and buy-in, the work is really about connecting what you are bringing to the table and aligning it with the interests of people that are decision makers or the people who can influence decision makers. So like many of you elevated, this idea healthcare providers want to work with you because as a CHW, you have a strong community reputation, right? You have the trust and relationships with patients that they don't have, and therefore the ability to support patients in a way they as providers cannot. So coming back to this question on the slide here, what are you bringing to the table to advance CHW financial sustainability? Relationships are a major source of power, right? It's part of what you're bringing to the table. And there's also so much more that you bring. Advance that slide, please. So you also are bringing your individual and organization staff time, right? Your experience and expertise. Your monetary and non-monetary resources are also at play at times here. Your credibility and ability to represent a base constituency, like in what was elevated before about a relationship with healthcare providers, much of that is about that the credibility of what CHWs do best and how CHWs do that work, and the connection to the community and being of the community. And of course, along with that is your relationships then, right? Your deep connections, deep relationships within the communities that you serve and represent. So that brings us to this resource inventory, which is where you can document your current relationships and other resources to have a fuller picture of everything that you bring to the table. And you can do this as an individual or as an organization, and we recommend you do both. So I'm gonna pass it to Essie, talk a little more about this.
Thank you. Before we get into this adorable picture on this slide, I just want to kind of pull this together for a moment. So what we're talking about is our approach, Envision's approach to financial sustainability is the same as when we're saying growing CHW power. It's starting with what you know, and building relationships, and the relationships we have is crucial to CHW work. And so we start with that, but there's so much more. And so that's why tools like the resource inventory can be great for us to look at all the things and all of the resources and assets that we already have at our disposal when we're thinking about one of these different pathways or multiple of these financial pathways to get started on. So, okay, now back to what we really want to talk about, which is Winnie the Pooh. So on this slide, you all can see we're going to visit, come with us please, to Imagination Land, where we are sitting at this table, and I'm not sure whose house it is. If you know, please put it in the chat. It's either Rabbit or Pooh's house. But I love this picture, and so does Leslie. It's just very cozy, and we're imagining right now that Pooh and Tigger and Rabbit are sitting at this table, and they're thinking about CHW sustainability. It's Pooh's house. Thank you, Laura. Thank you. Okay, so we're at Pooh's house, and we're talking, and we have a nice cup of tea or whatever you like to have with a little blanket on maybe a dreary day, and we're thinking, what are all the things we bring? What are all the resources that we have at the 100-acre wood 501c3? That's what we're envisioning here as our example, okay? So let's look at the next slide. What are some of the things that they came up with? Okay. So for staff, this is when we're thinking about time, experience, and expertise. Well, Pooh says, okay, I'm a CHW and I work in care coordination, and he's a community organizer. Tigger is a CHW, community organizing and fundraising experience, and he has excellent public speaking skills. Rabbit is a CHW ally, program and personnel management experience, is a certified dietitian, a gardener, and has lobbying experience. So those are just some of the things between all of them that they have together as part of their resources before even starting to try to think about how they're going to try and sustain CHWs at the 100-acre wood 501c3. Let's look at funding. For monetary resources, they do have a social enterprise. They get income from the honeybee farm, so they listed that. For non-monetary resources or non-staff resources, Christopher Robin donated land for a community garden and housing for all the staff and all the office buildings. That is huge. Those are huge things, right? Okay, now organizational reputation. Things that are advocacy related. Well, Pooh and Tigger have successfully advocated for housing initiatives. So that's something that the community knows, yep, they're good at this, and they do what they say they're going to do. And housing opportunities have been better and increased with this organization. So they have some credibility. And then their general perception as a quality organization. They have received awards from the school district for their impact on youth mental health. So that's another thing, acknowledging the work that they've done. And they are representative for the base constituency of the 100-acre wood residents. They are residents themselves. They are impacted by the same things that they are helping others through. I'm going to pass it over to Leslie, who's going to talk more about the relationships.
All right. So everything that Essie just named, right? What they have going into this work, their staff, their funding, their organizational reputation really comes through and is expanded through their relationships. So what did they put down in their relationships? So they have connections to CHWs and CHW allies. Pooh and Tigger are part of a strong CHW network and are very close with a CHW leader, Kanga. And Pooh leads the 100 Acre Woods Youth Mental Health Coalition with Owl from the school district and Eeyore, a mental health navigator. And of course, they have they've through time have fostered a very deep relationship with a key decision maker, Christopher Robin. So Christopher Robin is an ally, a philanthropist, and the mayor of the 100 Acre Wood. Okay. Thank you so much for playing along with us, for coming to Imagination Land with Essie and me in the 100 Acre Wood. So now we're gonna take a step away from the 100 Acre Wood and actually think about what this means for all of you. So we're gonna go into a bit of an activity where you can fill out your own resource inventory. So we're asking you to just start the resource inventory. We recognize that you may not complete it. It's all good. So what we'll do is we're gonna put a link in the chat to access this fillable worksheet and give you some time then to consider the resources you individually bring and the resources your organization brings to CHW sustainability efforts. And using that fillable table, or using that fillable worksheet, I should say, you list the resources you came up with under the categories shown in the resource inventory worksheet. So staff, funding, and a reminder within funding that it's both monetary and non-monetary, so in-kind volunteer type things fit in. Organizational reputation and relationships. And so we'll give you about 10 minutes here to spend some time filling that out. And then, and filling that out individually, and then we'll take some time to talk about this as a large group. Please let us know if you have any trouble accessing the fillable PDF there, their resource inventory. And also, we're all just going to stay in the big room here together. So if things are coming up for you, if you have questions, if any of our directions were not clear, go ahead and put it in the chat or come off of mute. We're hanging out here with all of you.
So putting it all together, for folks who were here last week, a lot of what we talked about was building on some of those principles of building CHW power and how that needs to be really rooted in CHW leadership and CHW and ally partnerships. And we did hear from some folks like Monica and Barbara who shared how they see that even in some of their work, how important the relationships and partnerships are. So what we're going to do is think about putting the things together we learned last week about growing CHW power, and then this webinar on on financial sustainability. And then y'all putting the fun back in funding, right? With this toolkit that we created. So we have created something that encompasses kind of all the themes that we've talked about in the last 2 weeks, which is starting with what you already have, CHW leadership and CHW allyship, having a sustainability goal in mind, prioritizing a financial pathway, having those strategic relationships, and really importantly, action planning. So, since this stuff is complex and we recognize it's a lot, like I said, we put it together in a way that we hope is more digestible into the Financial Sustainability Toolkit. And I'm going to talk a little bit more about what that looks like in the next slide. And thank you. Yep, Monique just dropped a link. If you all would like to look at the Financial Sustainability Toolkit, you can open up this link and click on it, and it'll ask you for like your email and some information, and then it'll give you a copy. Okay, I'm going to go over the flow of the toolkit really briefly. Inside, there are several different sections and there are worksheets. Now, there are sections right now, we'll tell you what they are. We have some sections right now on Medicare reimbursement, Medicaid reimbursement, and then we have an introduction really about our inventory, starting with what you know and things like that. And I'm going to talk more about it. So the worksheets inside the toolkit are really there to help you assess your relationships with individuals, organizations, institutions, and networks in connection to decision-making power. So think back to the Power Map from last week. And if you haven't watched that webinar, I encourage you to do so. This way, you can make informed decisions about which of these major financial pathways to prioritize and what steps to take towards action. So the toolkit starts with a more in-depth description of Envision's approach to building CHW power through relationships. And next, we have that inventory of what do folks already have, the resources, the relationships, the programs that are currently operating. What do you want to sustain? Next, it moves on to analysis and decision-making power based on that inventory. So thinking about what kind of relationships do you need to have, and who has power to make those decisions or to make change happen based on the approach that you're looking at. And then it moves on to determining action steps. Throughout the entire toolkit, there are call-out boxes that emphasize CHW leadership and in each sustainability pathway that we've talked about. And it helps you to think more about that action plan. What are you going to do next? Have some accountability. Who is doing this? Who is reaching out to whom? How are they doing it? Who has the relationship with this person, et cetera, et cetera. So that's a really, really, really brief overview, y'all. We encourage you to open it up and look at this link. And we're going to have more resources coming. We can talk about that on the next slide. So right now, the toolkit is divided into 6 sections overall. However, we only have 3 published. So we have the first section on financial sustainability, the general, and then Medicare and Medicaid. And coming soon, we're going to have another section on the systems change for CHW integration, blended and braided funding, and then putting it all together in an action plan. So there are 6 sections. Again, 1 through 3 are available now. And then this summer, we're going to have additional sections focused on what I just listed. And you can get a copy of it by clicking on the link in the chat that Monique dropped and looking at Envision Sustainability webpage, which has a lot of other cool stuff, by the way. So I encourage you to check it out. And then sign up to get a copy of the toolkit. And I'll pass it back to Leslie.
Thanks, Essie. All right. We are going to, thank you. All right, some things that we want to keep in mind about this, right? This process, I mean, this will take time. So brainstorming and plotting out sustainability approaches can be exhausting and frustrating. And I'm sure many of you have experienced that. And oftentimes it feels unfinished and we want to find solutions and we want to move to action, right? Like we want to be like, okay, this is what we're doing and go. And this toolkit is really having us slow down and examine where we are at and the best course of action for moving forward, because we're thinking about things around sustainability. And sometimes we have to do both ands here, right? Like, so sometimes we are finding quick solutions and also plotting out, moving through, or sometimes trudging through the slow sustainability process. And then that's okay, right? That's meeting us where we're at and where the workforce is at. And it's okay to not have all the answers. This process is iterative. So we're not going to know all the things right now and or ever, right? We are individually. But we're starting, and that's also where our relationships come in, right? We expand our knowledge, we grow our knowledge through those relationships. But that said, you know, when you're reading through the content in the toolkit, it can feel extensive at times, and it can get easy, or sorry, I should say it's easy to get lost in the details. Sometimes it may feel easy too to get through the details. Both can be true. So it can be helpful to step away or reach out to others for support. And when we work with communities, part of our facilitation role is actually just noticing when folks are getting stuck. And a lot of it is like giving that permission to not have all the answers. And so we want to say that here, right? That it's like, it's all good to not have all the answers. It's a starting place. And that really leads into that this work requires collaboration and communication. So it's important to consider who else needs to be part of these discussions, who's missing, and think about CHWs, CHW leaders, CHW state associations, et cetera. And you know, any of your community partners, and share this link, the link that's in the chat, right? Share that so that others can get the toolkit, so that you're working on the toolkit together. Feel free to share, you know, get together around the virtual table or the physical table and move through this work. And we want to really note that you have support. That Envision team is here to support you. You've got, you know, folks locally in your community that probably can support you too, right? So you can find support. So the best and most effective way to utilize this toolkit is in tandem with technical assistance. And we can help you think through ideas and approaches that would be a good fit for your community's needs. And really, we can bounce ideas. You know, we can be that voice to say it's all good, right? Like you have everything you need to get started. And so reach out to us. You can use our sort of general email, hello@Envision, which I think is going to pop up in the chat there in a moment. And then we want to invite you too that if you have questions right now or just want to hang out and chat with us, we're gonna stay on for Q&A. So that's another way to get more information is hang out here for the Q&A. So thank you. And I'm gonna pass it back to Mungshi, but before I do that, want to appreciate y'all so much for participating with us today. It is truly a joy for Essie and I to talk about financial sustainability, something we get really excited about. We recognize that, you know, that makes us sort of those nerds in the room that just love to talk about this. So thank you for spending time with us today. It's been really fun.